Hi, I'm Dr. Alan Koffron. I'm a transplant and hepatobiliary surgeon with USA Surgical Associates. In medical school, surgery was the most exciting to me. Why? Because you had the ability to fix something immediately. My dad was a carpenter, and working with him, figuring out how to put two things together that worked was very, very gratifying. Within people and surgery, you're able to do that every time you're in the operating room. And the thing that is particularly fascinating and rewarding about liver and transplant surgery is you have to be ingenious. You have to take something out, put something back in, and it has to work. It can't leak. And it's very much like my father's craft, where he used to say, measure twice, cut once. It's very germane to what I do every day. Originally thought I was going to be a veterinarian until I saw the light and became a human doctor at the University of Iowa. I then went on to surgical training in Chicago, where I trained in general surgery, but also pediatric surgery, critical care, and then hepatobiliary training. Stayed on at the Northwestern University for the first third of my career, and then moved to build a program in Michigan. That was a successful endeavor, and then I was recruited here to Chattanooga to work with USA Surgical Associates and Erlanger Hospital. My philosophy of care probably comes from my son, which is ironic. When he was young, he told me that he thought I was a plumber, and I thought about it, and I am, in many ways, a human plumber. But it's more than that. As you can tell, I've met a few surgeons personally in my lifetime, and I tend to think about surgery on people from their perspective. What are their concerns? They're an individual. Having gone through surgery myself, I know in general what they're going to go through, and combining minimally invasive surgery, also trying to understand what they personally find most threatening, helps them through that journey. So I go from being a plumber to a healer, I guess you could say, having been through medicine myself. Chattanooga represents the third transplant and liver program that I've helped in my career. The reason that I came here from my former program was it represents a very cohesive health system and medical community. As I mentioned before, you can't just be a plumber, and you can't just do it by yourself. You need a cancer care team to look at all the different options for a person, including surgery. This area has a medical professionalism, which I find impressive. I can ask for help, I can ask for advice, and I get it without fear of embarrassment or pride. And everybody focuses on the patient as opposed to their own little business or clinic or endeavor. So that was very compelling to me when we were considering our recruitment. Growing up in Iowa, the agriculture is a part of who I am. So when I'm not at work, I'm typically outside trying to plant, grow, or harvest something, which sounds unusual. Fortunately, my wife, who's also a surgeon, is an exceptional cook. So all I have to do is provide her with the food sources, and that's sort of a smart thing to do.